Welcome to Mind Matters with Dr. Gochukwu Ojiako. In the first series of anxiety disorders, we discussed anxiety, the different levels of anxiety, their symptoms, and how to seek help. If you have not watched that video already, please endeavor to do so in order to better understand our upcoming series on the different types of anxieties. So today we'll be discussing panic disorder. Panic disorder is a type of anxiety disorder that causes sudden panic attack, terror, and fearfulness. It is a pathological level of anxiety often associated with the feeling of impending doom when there is no real danger. Panic attack can bring about feelings of loss of control and physical symptoms such as shortness of breath, weakness, palpitation, nervousness, abdominal pain, chest discomfort, numbness, and tingling. Panic disorder can occur at anywhere and anytime without prior warning. It usually intensifies within a short, self-limiting period of about 10 minutes of onset. Panic disorder is more common in women than in men. For a diagnosis of panic disorder to be made, one must have had a discrete episode where the person experiences 4 or more of the following symptoms. Symptoms are usually sudden in onset and peaks within 10 minutes of onset. Paresthesia, which is feeling of pins and needles, feeling very hot or feeling very cold. Fear of losing control, fear of dying, nervousness, abdominal pain, and trembling. After the initial episode of panic attack, people live in fear. There is often change in behavior related to the attack. People may avoid places where they have had attack before, and for others, fear may take over their lives to where it may become difficult for them to leave their homes. Some individuals may be discouraged or even ashamed of inability to control their emotions. According to Johnson and Van der Hoof, in 2/3 of the cases, depression starts first, then followed by panic attack. In 1/3 of the cases, the reverse is the case, which means panic attack starts first, then followed by depression. Physical exam findings are usually non-specific, especially if there's no active attack going on. Those non-specific cardiac-related symptoms like shortness of breath, palpitation, and numbness are what usually make patients go to the hospital to seek treatment. Mental status exams usually shows general findings of anxiety. Those findings are pronounced if there's an active attack going on and less pronounced in the absence of an active attack. There is also a high level of anticipatory anxiety between episodes of panic attack. Although I said earlier that for a diagnosis of panic attack to be made, that one must have had a discrete episode where the person experienced 4 or more symptoms that I mentioned earlier. It is important to note that panic disorder is not the only condition that causes those symptoms, so it is essential to narrow down and rule out hyperthyroidism, hyperparathyroidism, seizure disorder, vestibular dysfunction, cardiac arrhythmias, central nervous system stimulants such as cocaine, caffeine, amphetamine, and even other types of anxiety disorders. It is also important to note that general medical disorders should be considered if the first episode of panic disorder occurs after the age of 45 with atypical symptoms such as vertigo, headache, loss of consciousness, incontinence, slurred speech, and amnesia after attacks. Clinical management of panic disorder usually follows the general guidelines for treating anxiety, which includes medication management and therapy. Many people do well on combination of medication treatment and psychotherapy. However, your mental health professional will work with you to design the best treatment plan for you. Comorbidities of panic disorder, which means other conditions that can coexist with panic disorder, are major depressive disorder, social anxiety, OCD, or obsessive compulsive disorder, and substance abuse. In our future videos, we will discuss the other types of anxieties, which will include social anxiety, specific phobia, agoraphobia, and generalized anxiety disorder. Our email address is located in the description, so please feel free to send us your general questions. We will randomly select questions to be addressed in our future series. So like, comment, subscribe, and share this video with your friends and your families. Thank you for watching. I am Dr. Ogochukwu Ojiako. Thank you.